Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth. Everybody. Testing. Okay. Let me go to the comments. There we go. Can we hear? I see the senator in the background. I see Miss Young in the background. I'm sorry about that, guys. We had just a little connectivity issues where we are on the road mobile again. All right. So, welcome to Telehealth Tuesday. Third time's a charm. This is your go-to podcast for insights on modern healthcare and wellness solutions. I'm Dr. Michael Bookhart, your host, and today we have very special episode lined up for you. Before I get into our guest bios, I would like to thank tonight's episode sponsors, Graphics R Chase, P5 Solutions, and also A Dime a Dynasty. I also want to let you know that Telehealth Tuesday can be viewed on multiple platforms, including our YouTube channel, which is Dr. B TV. That's the word DOCTOR, the letter B TV, and also our Good Faith Wellness Center Instagram pages and Facebook pages. Please follow, like, share, and subscribe to help support this very important program. Now, also, let's go ahead and get into these bios before I bring these most interesting guests into the room here. And again, I think we're all connected. Again, we apologize for the connectivity issues there, but I think we've got it together. Again, we are on the road. We are live. And so that's one of the things about live programs and live TV and broadcasting. I know our next guest knows something about that. So let's talk about Senator John Horhn. Senator Horhn is in the 32nd year, his 32nd year as a member of the Mississippi Senate, where he has been a champion for small business development and the city of Jackson. Prior to his election, his public service included serving as program manager at the Mississippi Art Commission, director of the Mississippi Film Office, director of the Mississippi Tourism Office, and executive director of the Governor's Office of Federal and State Programs. Senator Horhn is chairman of the Housing Committee in the Senate, vice chairman of Veteran and Military Affairs, and his other committees include Medicare, Finance, Energy, Tourism, Business and Financial Institutions, and Labor. For 12 years, he has chaired the Senate Economic Development Committee. Senator Horhn has sponsored and or led the passage of bills authorizing more than 1 billion, that's billion with a B as in boy, more than 1 billion in projects specifically to support the city of Jackson, including public facilities, hotels, museums, and water sewer improvements. Wow. So that is Senator Horhn. But guess what? Wait, there's more. So we also have with us Miss Angie Young. And I want to tell you, let's tell you something about Miss Angie Young. Her company is called Young at Heart. And let's talk about Angie. Angie Young is a graduate of Pell City High School and the University of North Alabama. She began her career working in office administration, working her way up to accounting positions and then human resources with a few family owned businesses in the Birmingham area for over 10 years. Angie has a servant's heart for the senior citizens of our state of Alabama. She travels all over the state helping Medicare eligible clients get enrolled or make changes to their current plans. She volunteers at assisted living facilities, senior citizen facilities, as well as hosting her own socials for the seniors. She states, I love what I do. I develop relationships with my clients. A lot of them remind me of my own grandparents. Angie's also a member of the NABIP, which is the National Association of Benefits and Insurance Professionals. She serves on the state and local boards as the Professional Development Chair. She's also a member and serves as an ambassador on her local Chamber of Commerce. Without further ado, ladies and gentlemen, welcome Senator John Horhn and Miss Angie Young.
Hello.
Thank you.
Thank you.
Hello. Good evening. Good evening. How are you guys doing this evening?
Good. Doing good.
I'm doing fantastic.
Wonderful. Thank you all for joining us on this evening. And looks like everybody is alive and well. We've got good audio. I think we can see y'all, we can hear you. So without further ado, let's get right into it. Let's see. Tell us all about Medicare. Let's start with Miss Angie Young. Angie, if you'll tell us about Medicare, because we've got an audience here. I think most people probably obviously know what it is, but just in case there are people out there who this is the first time they're hearing it, please tell us what Medicare is and who's eligible for that, please.
So Medicare is the insurance plans that are available to people who are turning 65 years old or 65 and up, and those who have been on disability for 2 years. Of course, Medicare is ran by the federal government, and most people who are on Medicare are happy with it. They love it.
Okay. Senator Horhn, I know that you've been on the forefront of so many things. We read your bio. It's just, we can't even cover all the experience you've had. But I want to go ahead and try to kind of piggyback on that. And if you can tell us, what's going on in the city of Jackson, what is going on with Medicare? You can touch on Medicare and Medicaid, both government programs, but specifically the Medicare, what's been your experience with it, and are there any updates in terms of Medicare with the city of Jackson?
Well, thank you, Doctor. Excuse me. Thank you, Dr. Bookhart, and it's a pleasure to be on Telehealth Tuesdays.
Thank you, sir.
I don't have a lot of experience with Medicare except my own personal experience. It is not a program that is managed by the state. It's a federal program, whereas Medicaid is managed at the state level in all 50 states. even though it's a federal program. The Division of Medicaid operates that program in Mississippi, and it focuses on poverty level aged and disabled recipients. As Ms. Young mentioned, Medicare is focused more on folks with disabilities, but mostly senior citizens who are above the age of 65. And we have a number of programs that a lot of folks appreciate as it relates to Medicare. And I think Ms. Young can probably speak more eloquently to those than I could. But I have a lot of friends who have Medicare care coverage, and it is an essential program for them as they move along in age.
Absolutely, absolutely. And I guess like let's go back to Miss Young, and I appreciate that, Senator Horn. And again, we thank both of y'all for being with us. Miss Young, um, let's go back to the basics of this. One of the questions we had was, oh, looks like somebody we can't. Okay, I see a couple of comments saying that they couldn't hear us. I think that was previous, and somebody said yes. I think we should be good. Can y'all hear us out there? Can y'all hear us and see us? Can you see our two guests on here? Let us know if you can. If you cannot, and we'll take care of that. So let's see here. Okay. Um, so yeah, Miss Young, I wanted to talk about some of the specifics about that. One of the questions we had that was sent in to us, at what age should I start planning for actual Medicare enrollment?
So I tell my people to contact me around 63 years old. So that way they can start getting the basic information. They can be looking at some plan, kind of get an idea of what's going on. So when they do turn 65, and that's when they become Medicare eligible, they have a 7-month window to apply. So it's 3 months before their birthday, the month of, and then 3 months after. So
Okay.
once they
Okay.
start early, especially those that are still working or getting ready to turn 65. There's a couple of paperwork to get done, nothing major, some of the simple things that we'll fax into Social Security, and that way to get your Medicare started. And then by the time you are ready to turn 65, and it's just a couple of quick picks of the buttons, and you're ready to go.
Okay. Okay. Excellent. Excellent. And then one of the other questions, and also one of the things that a lot of people ask me, and as a physician, I know some of the basics, of course, about the ages, and like you were saying, prepping at 63, and then people at 65 and over. And this has been, of course, a hot topic. And I don't know how much the senator, wants to get on this. And of course, we'll put a quick kind of disclaimer statement. Certainly at Telehealth Tuesday, we don't endorse any particular party. We're not a politically affiliated organization, and so not to necessarily dive into the politics of it, but there are certain things, especially going on in the state of Mississippi as it relates to Medicaid, especially, and these are things that affect our patients. So anyway, but I wanted to ask a pointed question about the differences with just Medicare, A, B, and D, and things like that. I know that a lot of this stuff is available online, but since we have the two of you here, Ms. Angie, if you could maybe just elaborate on the differences, if you're able to do that.
Yeah, so original Medicare is Medicare Part A and Part B. Medicare Part A covers hospitalization. Medicare Part B covers basically everything else, any doctor's visits that you have to attend, any x-rays, lab work, test work that they need to get done on you. Everything, all of that falls under Part B. There's also Medicare Part C, and that's where the Advantage plans comes in. You either have Medicare Advantage or Medicare Supplement. I get a lot of questions, people thinking they can have both. You cannot have both. It's an either or thing there. And then Medicare Part D is your prescription coverage.
Mhm.
So
Thank you.
definitely get Part D. Most people would get original Medicare, which is A and B, and then they don't take D because they don't take any medications. If you don't take Part D when you're eligible, you are subject to late enrollment penalties. So if you don't
So
do
say that.
anything else, get your Part D.
Oh, can you repeat that for the people in the back, as they say again? That's very
Yes.
important what you just said. Can you say that again,
Yes.
please?
So most people will take original Medicare only, which is Medicare A and B, and they won't take a Part D, which is your prescription coverage, because let's say you're not taking any medications, you don't think you need a Part D plan. If you don't
Hmm.
take Part D when you are Medicare eligible, you are subject to late enrollment penalties. Once you get that penalty, it's with you for the rest of your life. It does not go away. So if you don't do anything else, take Part D when you sign up for Medicare.
And part B is in boy or D is in dog.
D as in dog, your prescription. So you have to
Okay.
have A and B, which is original, to get your Part D.
Okay. All right. I think that's very good. I was trying to get a couple of notes here, and also we got some questions pouring in. So, and I want to get to the senator. Senator Horn is there, but before I get to some other questions, so since we have you and we're not privileged to have a sitting state senator with us all the time, is there anything that you might want to interject, either uh, from a official from an official perspective, or also even your personal? I know you said that you knew your experience is what you had personally. Is there anything that you wanted to add before we get into other
Yeah, I
questions?
just like to emphasize the need to get signed up in time and to do it before those penalties kick in. I have several friends who say, "Oh well, I don't need that. I'm not sick. I don't take this. I don't take that," and so they wind up when they do get on medication, having to pay that penalty, and it can be a pretty hefty penalty that you're having to live with. I would like at some point to shift the conversation to the whole issue of Medicaid. There are a lot of folks
Absolutely.
who confuse Medicaid and Medicare.
Mhm.
Um, and even though Medicaid deals with poverty level, aged, and disabled, the folks who can qualify that, there's also a CHIP program, a child's health insurance program that is Medicaid operated. So Medicaid impacts and affects a whole wide range of folks, whereas, as Ms. Young has already indicated, Medicare is mostly for senior citizens and folks with disabilities for 2 years. So in Mississippi, a lot of folks are impacted by Medicaid, and Mississippi is one of about 10 states that has opted for the last 14 years. For 14 years, we've had this program in place. Folks called it Obamacare,
Hmm.
and it was a pejorative term at one time, but I think a lot of folks have embraced it and give President Obama the credit that he's due for
Hmm.
having originated this program. But in 10 states, and most of these states follow they're the same states that were the original states that seceded from the Union and were a part of the cause of the Civil War. Those states have a more generally more population percentage of African Americans than other states. Those states generally have very conservative leadership in the state, from the governor on down. The legislatures are very conservative, and so for the last 14 years, we've been we've been losing out on $1 billion a year, 9,000 jobs, and in Mississippi, around 300,000 working poor are eligible for this program, and they can't get it because it hasn't been expanded by the governor or by the legislature in these states, and Mississippi is one of those states.
Mm. Mm.
And
That.
so the historical uh, politics of these states, they're mostly southern states. All those states, Georgia has we call it Medicaid Light. It's a softer program that doesn't provide as many benefits, and they have a work requirement in their Medicaid program.
Hmm.
And the state of Louisiana has expanded Medicaid in its state, and the state of North Carolina has expanded it. but the other southern states from Florida all the way over to Texas have not. And it is political because if you just look at it from an economic development standpoint, who would turn down the creation of 9,000 additional jobs to provide 300,000 working poor? These are folks who are working 2 and 3 jobs. They just happen to be working those kinds of jobs that don't offer insurance as part of the job. And so their health care is the emergency room. They often will go to the emergency room, and it's often when they're really sick, as opposed to having the annual maintenance that will keep you in better health than just only popping into the emergency room when you're on your deathbed or deadly sick. So, just from the financial standpoint, we know that people have better outcomes if they go to the doctor on a more regular basis.
Yeah,
We know
absolutely.
that those costs are astronomical if you happen to go to the emergency room. And part of the problem we got in the state right now with so many rural hospitals, small hospitals, even the larger hospitals are catching a lot of grief because they have to cover the costs of uncompensated care. This is care that's not covered by insurance, is not covered by the federal government, and so those costs have to get passed on to somebody, and a lot of these hospitals are suffering along with these 300,000 working poor who are much more deserving of better health care than what we're affording them right now.
Absolutely, absolutely. Well, and look, I'm so glad that we that you touched on those things, because you're right. When it comes to healthcare, and especially from my perspective, being a physician, we see that, and it's something that is just so saddening and frustrating when people are not able to take full advantage of these programs and not able to have insurance. Which, of course, when I was also featured on your show on Tell John. Um, on your radio show, that we talked about the fact that healthcare is it should be a right of all Americans in this country, not a privilege. But again, that's a whole nother thing, because it's not, again, not even that it's political for me, but more so just the fact that it puts such a huge burden when people are not able to take advantage of these government and state benefits. But let me go back. We've got a few comments here. Got a couple of questions and a comment. Uh, we have a question. What about the penalty for applying late for Medicare? I think that would probably be a question for Miss Angie there.
So the penalty is averaging around 30 to 33 cents per month. So every month after you turn 65 that you don't enroll or you don't have credible coverage. So as long as you're working to have credible coverage, you can delay your Medicare as long as you have that coverage. But if for some reason you're no longer working and it's past your 65th birthday, so every month that you don't have coverage, don't have Medicare, it's about 30 cents per month, and it adds up. And like I said before, you're stuck with those penalties pretty much for the rest of your life, unless you're considered to be what they call low income and qualify for the Medicare Savings Program, which is a portion of Medicaid. I had a
Mm.
gentleman had Medicare for 12 years, didn't get
Hmm.
a prescription plan, and he had that late fee. It ended up being about 40 something bucks a month that he's having to pay now because he did not enroll in time.
That's
So
so
make
he's having to.
sure, yeah, make
Go
sure
ahead.
if you find out if you're working, if your group insurance is considered credible coverage, or if you're just not turning 65, make sure you find out what to do about your Medicare to avoid those late fees, because you're stuck with them for the rest of your life once they do incur.
Mm. Yeah, definitely. You definitely don't want to be stuck with that. Well, look, we're going to keep on rolling here. Appreciate that answer. Um, Nitra says also, okay, this looks like a comment. Also, for people who receive SSDI benefits, they may become eligible for the Medicare after receiving those benefits for 24 months. They may become eligible for Medicare based on a disability under the age of 65. Can you do you? I guess, are you following that? I'm seeing what she's saying,
So
but I
what
think we
she's
need to get
saying
clear.
is, I think what she's trying to say is people who have been on disability for 2 years. So on that 25th month, if you've been on disability, they automatically enroll you in Medicare. So I think that's what she's trying to say. So you can get Medicare under 65 due to disability.
Okay, okay. I appreciate
Dr.
that.
Bookhart, I have a question
Hey,
for Angie also.
sure, sure.
If you can walk me through, Angie, uh, what happens when a person who, has both Medicare eligibility and they have private pay insurance. For example, I have Blue Cross Blue Shield with the state of Mississippi, but I'm also of the age where I qualify for Medicare. What happens when a hospitalization takes place, or some sort of hospital treatment takes place? Let's say you're in an accident, you go to the emergency room. Uh, what kicks in first? Does your private pay come up first, or does Medicare?
So usually it depends on the size of your company. So if your employer has more than 20 employees, and I'm sure the state of Mississippi does, then they would be primary. Medicare would be secondary. If it was a small company like me, like my company is, then Medicare would be primary, and then my company insurance would be secondary. So it depends on the size of your group insurance. So 20 employees or more, then the group is primary. 20 less, Medicare is primary.
Okay, okay. Yeah, that's a great question. Great question. And also, just to piggyback, so you mentioned about, your company, Angie. Would you, matter of fact, let's just take a moment. Why don't you tell us exactly what it is that you do with your company?
Okay. So I own Young at Heart Medicare Services. I am licensed in Alabama. I also do Mississippi and Tennessee licensing. I do more. 99% of my book is Alabama clients. What I do is I help seniors who are turning 65, those who are past 65 that are already working, and those that are disabled find the right Medicare plan that's going to be beneficial to them. So
Okay,
the way I do that is I get their medications, I get their doctor's names, and I research. I
okay, okay,
narrow it down to a couple of plans, let them choose which one they want to enroll in, and I submit the enrollment for them.
okay. Excellent,
So
excellent.
those that are low income, I run into a lot of people who qualify for the Medicare Savings Program. Like I said before, is a level of Medicaid. I'm able to help them enroll in that as well.
Okay. Well, that is awesome. That's wonderful. Let's go to a couple of questions that have come in as well that were emailed to us. A writer says, if I switch to an Advantage plan and decided to switch back to a supplemental plan, what are their drawbacks to be considered?
So it's going to depend on what states you're in. Here in Alabama, we got one company that doesn't do underwriting, but most insurance companies will subject you to underwriting. So depending on your health situation, you may or may not be approved. And then also your rates could increase because rates for supplements are based on your age.
Okay, okay, excellent. Another question said, and we can also, I think the senator may want to chime in on this after you answer as well, Angie. We delved in this just a little bit. What is Medicare expansion actually? And does Medicare provide access to a professional to help me find the best plan for my needs? Which, of course, we know now. We know that you are that professional. But I guess the question seems to be: is there maybe somebody provided by Medicare or something like that? So
Yes.
yeah.
So as far as Medicare expansion, I think they may have that confused with Medicaid expansion, is what the senator spoke on a little bit ago. Because Medicaid is they are working trying to expand, which is raise the number so that more people are eligible.
Right,
Um, so
exactly.
I think that's they may have that confused there. I think that may be
Yeah, it
Medicaid.
might be. Yeah, I think so. It might
But
be.
as far as professionals, yes, Medicare does have people that will help them enroll in plans. You can call 1-800 Medicare. You can go to Medicare.gov on the internet, or you can find a independent agent like myself. We're all over the country. One way to find it, you can go to our National Association page. This is www.nabip.org. Click on Find an Agent. You can put in your zip code, and it will show you any agents within 100 miles of you. These
Uh,
agents on neighbor.org, we're all certified. We do testing every year. We're part of the professional organization. We go to DC every year and speak to the members of legislators to discuss healthcare issues. So we're here. We're out here to help people. If somebody don't know
Absolutely.
how to find an agent, they can call me, send me their zip code. I'll look somebody up for you. I know because I do a lot of these conferences. I know people all over. So if I don't know somebody in your particular city, I can help you find somebody.
Well, that's awesome, and we appreciate the work that you do. And I know from my own experience with my mother, who's over 65, and then just even the patients, excuse me, the patients in the hospital, that ask us questions like, "Hey, if I go to the nursing home, is this covered? If I want to go to a swing bed or a rehab placement, or what about if and then they sometimes the case managers get involved and they say you got to take a lien on your personal property. They got to give them your all your information, and they look at what assets you have. It just gets so convoluted. And I guess mine is more of just a statement of personal testimony, just seeing from my mom and other people when they get their bills and they see what's allowed, what's disallowed by Medicare and this and that. And it gets really, really confusing. And I have no idea why it even needs to be this way, but it gets extremely confusing. So I'm glad we're on here. Here's another question here, and maybe the senator might want to tackle it first. What efforts are being made to reduce the cost of prescriptions, and why do some pharmacies decline the Advantage plans? Senator, I don't know if that's something that you want to talk about, or things that are going on locally, and what the state is trying to do for part of that, or if Angie, then you can maybe jump in.
Well, on the Medicare aspect, I think Angie probably would be better
Angie,
qualified
but yeah,
to speak to that.
So as far as prescription plans, actually, there's something big coming for 2025. The Inflation Reduction Act that was passed a couple of years ago is doing away with Medicare's donut hole. I'm sure everybody has heard the donut hole, but may not understand what that is. So Medicare donut hole, as of right now, is capped at around $8,000 per year. So that means somebody could spend up to $8,000 on their medications per year. Um, that's going away for 2025. Donut hole is disappearing. So now for 2025, they're capping drugs at 2,000. So the most money you spend on your prescriptions for the whole year is $2,000, and that's gonna people who have to take insulin, the diabetics. Insulin is one of the biggest ones that I see quite a bit. They're really, really expensive. So once they spend 2, 3 months on their medication, then the rest of it is covered at 100%. So that's a big thing that we're all excited about. But of course, excitement comes with a little bit of disappointment because now the insurance companies are having to absorb more of that prescription cost, which is making the premiums go a little bit higher. So I'm telling everybody, if you don't have an agent, find you an agent to check your plan for 2025.
Senator Horn, I think you might have a new agent if you don't have one, or if you need another one, or if you got one, you might want to change to.
I know where there's a good one to be had.
I hear
You
you.
know, when you talk about that Infrastructure and Jobs Act, one of the things, and this may be part of what Angie was discussing, the cost of prescription drugs can be ungodly at times.
Yes.
And
Absolutely.
the Infrastructure and Jobs Act capped the cost for insulin, which a lot of folks, especially in our community, have to pay. And they capped it. I think it's between $30 and $45 per prescription, whereas it could have been several hundred, in some cases, even in the low thousands of dollars. But I do want to mention one other thing about Medicaid,
Hmm.
and that is you can become eligible for a nursing home uh, and to go into nursing care if your health begins to fail and you have to get some sort of assisted living or a nursing home care. A lot of times they want your assets. They want you to cough up your house, turn that
That's right.
house over to them. They want you to have access to your savings. They want to have access to a lot of your resources. And a lot of times, folks who are not in the know become victimized by that. But
Hmm.
one thing that if you don't do anything else for your parents, your mother, your father, your grandmother, grandfather, whomever, tell them that they need to get a trust set up that will protect their assets. Now you might say, "Well, mom ain't got much money. Mama's house only worth $50,000. She only has 7,000 in the bank. That's still mama's money." And the way that you want to make sure that they're protected is to put a trust together that
Mm.
will shield those resources from the folks at Medicaid. And that is perfectly legal to do this. But a lot of folks don't know it. And there are a lot of people who are fairly well to do, but they put their assets in a trust in order to qualify for Medicaid coverage and especially nursing home coverage, where the government picks up most of those costs. But if you don't
Hmm.
have that legal document in place, you might be one to lose all of your assets to the federal government because they want their money. And one of the things that I recall with an aunt of mine, that folks need to remember is that if you don't have a trust put together, but you have, and they're threatening to take your house, if you have a relative or a trusted individual who stays in that house and they have nowhere else to go, then that house is protected as well.
Mm.
So it's just a few little tricks of the trade that will protect
Yes.
your assets and make you eligible for government benefits to the fullest extent.
Absolutely. Well, look, like I said, ladies and gentlemen, if any of you are just joining, I'm seeing some things, some other comments coming in here on Telehealth Tuesday. As you can see, again, we are live, and this is the only place that you're going to come and get this wealth of knowledge. We've got Miss Angie Young here. We've got Senator Horn, who knows more about the state of Mississippi and politics and economic development. He knows more than I've ever forgotten. So we're thankful to have them. So let's keep on rolling. Look, I got a couple of questions that have come in. I got a couple of folks that are also sending questions right now into my other devices. So let's see. Actually, there's three. One of them, I'm gonna take this one on real quickly. Dr. Bookhart, do you personally accept patients with Medicare and Medicaid? And the answer wholeheartedly is yes. So we are definitely at Good Faith Wellness Center seeing patients with Medicare and Medicaid. And actually, still to this day, I'll check with my back office, but right now we are still here. Every single type of insurance that there is on this planet, we accept for now. Now, I don't know how long that's going to go on, but for right now, we wanted to start the practice where we accept all insurance so that nobody's turned away. All right. Second thing here. What are some services that, this would be a question for Angie. What are some services that Medicare does not cover?
Um, Long-term care in a assisted living facility, definitely not
Hmm.
covered. I get asked that quite a bit.
Absolutely.
It's not covered. You can do assisted living for like rehab services. It's covered up to about 100 days usually, but anything over that, long-term care is not covered at all. Now there's a couple of medications that's not covered that you'll run across every once in a while. That's why it's good to have you an agent that can look that up to let you know if your medicines is covered by Medicare. There's no rhyme or reason to why something is not covered. I ran across one today, and it retail for $18,000, and it's not covered by Medicare. So she's got to go back to her doctor and talk to them about getting something else.
You said what? I'm sorry, what retail for 18? What was it
It
that?
was a prescription that one of my clients
Oh,
called me on today.
hmm.
It retailed for 18,000. It just wasn't covered by Medicare. So just make sure that you're getting your prescriptions checked. Make sure that everything is covered.
That's so important.
Yeah.
Senator, well, this is a question for both of you, but I just kind of want to, make sure we going back and forth here with Senator. I want to know, do you feel like there are any key considerations that people fail to make when they're evaluating different plans, or maybe even, personally did some things that you felt like that you would have, maybe wanted to think about when considering the plans that you have, just some things maybe you thought like you wish you had known, before.
Well, that prescription drug sign up is something
Hmm.
that I was very thankful that I found out about it as I was setting up my signing up for the program. But let me go back to Medicaid for just a minute, because a lot of folks in that Infrastructure and Jobs Act, um, the federal government put in a feature to encourage some of these states that have been reluctant to sign up for Medicaid expansion. The federal government created a healthcare exchange, a federal healthcare exchange, where they subsidize. If you want to go, you don't want to get on the Medicaid program, or you haven't been approved for it, you can sign up for a federal healthcare exchange that is subsidized by the federal government. So you have a private pay insurance policy, but
Hmm.
you're paying a lower than market rate cost because of the federal subsidy. They give states the option of setting up state exchanges. And so Mississippi is creeping towards providing more coverage for some of these working poor. But they're doing it through this federal exchange, and the state is probably going to set up its own state exchange. So if you are among the so-called working poor, and that means that you're making more than $15,000 a year, but
Hmm.
less than about $22,000 a year. That's the gap where folks where we're trying to expand Medicaid to is for people who are between 15,000 and $22,000 in annual salary or annual income each year. The,
Hmm.
the, so there's some other ways that are coming online where the expansion of Medicaid may not be required, but you can qualify for that federal subsidy, or a state exchange that's also federally subsidized. So you can get insurance. It will cost you more than it would cost you if you're on the Medicaid program, but it costs less than what you pay in the then you pay market rate, in just an open marketplace.
Hmm.
So
Okay.
folks need to know about that, because a lot of folks, they don't
Absolutely.
know that there's a federal exchange, or that it's possible for the state to set up a state exchange, but that might help lower your cost of medication and hospitalization and so forth, if you just knew about it. So we're trying to get that word out as well.
Absolutely. Well, no, we definitely appreciate that, and I know the listeners and our audience appreciates that as well. Uh, and look, ladies and gentlemen, again, this is a live show where we are welcoming questions here. I've gotten a couple more that have come in, and I see that we've had Anitra on here. She has had a lot of. She is pouring in here and adding a lot of things. She was saying that for Part B coverage, B is in boy, the LEP is 10% of the premium for each full 12-month period that they are not enrolled, and it could be a lifetime penalty. The Part D, D is in dog, LEP, is the 33 cents, looks like, per month for each month of eligibility. Um, I don't know if Angie, I don't know if you want to chime in on that, but I think she was just kind of piggybacking a few minutes ago on you had what you were saying.
Yeah, she's basically explaining the late enrollment penalties that you can have, because you can have a penalty for Part B, as in boy, which is the hospital, which is part of the original Medicare, and then you can have one for Part D, which is your prescription coverage. So the
Excellent.
LEP, she's we as in the Medicare world, we say LEP, which just stands for late enrollment penalty.
Gotcha. Okay. I appreciate you, because at first it was about as clear as mud. So I appreciate you clearing up that acronym there. Uh, Here's this is more of a scenario or a comment. Well, and then there's a question here. I tried to get an appointment with a doctor, and I was told that they had had their quota of Medicare patients quota. I offered to pay and was told that this is against the law. Is that true? Question for Angie.
And that's the question. I really don't know. As far as the doctors having a Medicare quota, they may not be accepting any more Medicare patients, and I have seen that happen before.
Hmm.
They're not taking Medicare patients, but being able to pay cash, I'm I'm not
Hmm.
really sure. I haven't run across that issue.
Have you, Senator Horn, have you
Well,
personally,
I would say
run into that?
that's probably a business decision that that doctor or his clinic has made.
Mhm.
I don't know that you ever reach a quota. They may have a self imposed quota that as a clinic, our business model says that we only need to see 20 Medicare patients a month, 20 Medicaid
Mhm.
patients a month. That's
Mhm.
probably their business model, but I don't think that there's a federal quota or state quota on any of that.
Well, right now, um, you're absolutely right on that. I know several providers, physicians who have done that, and there are some that even choose not to participate in government programs and state programs and things because a lot of physicians feel that the reimbursement is extremely low for them. And when you get in the hospital, they've got these bundled kind of things where when you have surgery, say elderly placement goes in, unfortunately falls, breaks a hip, they come on in, get admitted by the ER. They admit to the medicine doctor, hospitalist doctor like me. We tune them up, make sure that everything, their diabetes under control. Any kind of comorbidities or risk factors, make sure those under control. The patient is cleared for surgery. They have surgery, and the hospital gets a large bundle payment for that from Medicare. So I know sometimes from what the administrators have told me that that's good business for them, but in terms of primary care, there are a lot of doctors, yeah, who just don't even, accept it, and which is quite a shame because I know a lot of people look forward to working all their lives and they get to this
Right.
place where they can retire, get Medicare, and use these benefits, and then now you hard pressed to find a doctor sometime that accepts it.
Mhm.
So um, let's see, we had a scenario here. One other example: I have a supplement plan and I see advertisements touting Advantage plans that are attractive, especially with gym memberships and other rewards and benefits that I do not enjoy with the supplement. And with Medicare and the supplement, I've tried. I've not had to pay out of pocket costs. I recently was in for a post operative visit and could not help overhearing a patient there for the same type of visit, and that patient was advised that there was a balance, and would she be able to pay today? How Angie, could you possibly weigh in on that scenario and say how is that normally handled and why did that occur? For that patient.
Okay, so the first part of the question was asking about some of the benefits of the Advantage plan versus a supplement. And
Yeah.
I'm saying she, I guess it was a lady. She mentioned gym memberships. Some supplement carriers do have gym memberships. Check with your state. Find you an agent in your state and ask them. They can tell you if there's one available to you that does have a gym membership.
Hmm.
Um, the second part of the question about paying the out of pocket costs. So on Medicare supplements, these people are on these plans, they pay a monthly premium, they pay one yearly deductible, and once that yearly deductible has been met, anything they have done considering their health is covered at 100%. So people who have Medicare Advantage plans, they're going to have copays. So they're gonna have some small copays here and there at their primary for like outpatient surgery or specialists. Any any test that they have done, they're usually gonna have some small copays. So that's probably what she was hearing because she has to supplement. Hers was covered at 100%. More than likely,
Right.
she had made her deductible already. Where the other lady might have had a Medicare Advantage plan and she might have had a little small copay and had to pay that.
Okay. Excellent. I appreciate that. And then the other part of this, they said that there was a elderly lady in a wheelchair, but the reply from the medical clerk was alarming. Her response to the patient was, "You have an Advantage plan. The red, white, and blue card is no longer used." What did she mean by that? And how are the costs for Advantage plans so little?
So the red, white, and blue card is it doesn't go away. So you have to have that to get a Medicare Advantage plan. If you only had the original Medicare, which is the red, white, and blue card, you are subject to 20% copays. 20% of a doctor's visit may not be much, but 20% of a surgery could be quite a bit. So that Advantage plan supplements that original Medicare, where now instead of paying 20%, you may have a $245 deductible for like an outpatient surgery or something. So it's more, you kind of know more of what you would have to spend out of pocket on an Advantage plan versus original Medicare, because original Medicare is just straight percentage.
Okay. I appreciate that answer. Thank you for clearing that up. Senator Horn, just curious, this is my own personal question. When it comes to elected officials, I know that, and especially with with the U.S. senators and the Congress people, they got some of the best healthcare in the world. Do well, I guess I don't know, what are your feelings about, or what could you help us understand, say when an elected official here in the state of Mississippi, once they reach 65, and is it that the benefits are covered, full retirements and health insurance and all that kind of stuff? Is there like a plan for elected officials, or can you opt in to have Medicare, but then have whatever else the state would afford you guys, or how does that work?
Yeah, well, being state employees, members of the Mississippi legislature have the same uh, coverage as state workers or school teachers or city
Okay.
workers. So we're covered under Blue Cross Blue Shield Mississippi. If you are a federal employee, excuse me, a federal member or employee of Congress, you have what's called Blue Cross Federal, and it's better coverage than what Blue Cross Mississippi covers makes available. But they're both pretty good insurances. But you still have to, if you come of age, you still have to sign up for Medicare. You still have to do all the things that an average citizen would do. But if you are, my father, for example, worked for Congressman Benny Thompson for 20 years, and he retired from there, and he has Blue Cross Federal now. But even with Blue Cross Federal, even with Medicare, you still wind up coming out of pocket from time to time.
Hmm. Well, I appreciate that answer there. That was I was just curious about that myself. Two quick questions before we start our closing statements here. We got a question that came in that says, "How much would I expect to pay for agent services?" That goes to Angie.
Most agents, like myself, we do not charge our clients a dime. My thing is to make sure
Hmm.
that you are enrolled in what is right for you. I have people walk in here and I'll tell them you're on the best plan, stay where you at. I don't charge anything. My money comes directly from the insurance carriers when they are enrolled.
Okay.
And me being an independent agent is our money is regulated by the federal government. So it doesn't matter to me which insurance company you decide to enroll with, we're going to get paid the same thing. So there are some agents that do charge an administrative fee for checking medications or doctors and things like that, but I do not do that at all. I figure it's part of my job. That's what I'm here for.
That's fantastic. Fantastic. Let's see. I think we might have time for one more before we start wrapping things up here, and then we'll take the next question that comes in. Actually, you know what? There was one that came, and I meant to ask this one earlier, but I know we kind of jumped around a little bit. So let me bring it back to the Medigap and the donut hole, because I think both of you might have mentioned this. I know, Angie, you did. Could you just help clear that up for us quickly, please, about what is the Medigap and what is the donut hole?
So Medigap, you hear it called Medigap, you hear it called Medicare Supplement. It's all the same thing. So that is the plan that people pay the premium for and they have 1 yearly deductible, and anything they have done is covered at 100%. So just about every insurance company out here has a Medigap plan. It's just going to be on your preference and what you can afford. Now that's Medigap. The donut Medicare donut hole deals with your prescription costs. It's a Medicare rule. As of right now, it's capped at $8,000. So you could spend up to $8,000 on your medications before you come out of the donut hole per se. And then, like I said, next year that donut hole is going away altogether. So the most you will have to pay is $20.25. So I've been doing this for 5 years, and I've been hearing the donut hole is going away. It's going away. Well, it's finally here, and it's going to be pretty good for a lot of people who take some really expensive medications.
Mm. That's a fantastic information. Well, look, I want to start with some closing statements. Angie, I want to go ahead and thank, well, I want to thank both of you all certainly for coming on Telehealth Tuesday and sharing with us. I'd like to ask you, Angie, what you have going on. You can just let us know how you can be reached, and then I'll turn to the senator. I don't know if I don't know, Senator, if you wanted to make any certain announcements or not. I'll leave that to you. We're fine with it if you want to. I know he's got some big things coming up, but real quick, Angie, so if you'll tell us, please, one more time, the name of your company, where we can find you, your name, how do we contact you, and let us know what you're working on.
The name of my company is Young at Heart Medicare Services. I'm located in Pell City, Alabama. I service the entire states of Alabama. I'm also licensed in Mississippi and Tennessee. I can be reached via phone call or text message to 205-338-1417. My website is www.youngheartmedicare.com, and my email is Angie@youngheartmedicare.com. Today's October 1st is starting the Medicare annual enrollment period. Now is the time to be reaching out to your agents. We can start discussing plans now. We can't do any enrollments till October the 15th. October the 15th through December the 7th is the time to make any plan changes you need to make to your Medicare plans. So make sure you reach out to somebody during this time period.
And real quick, what was that? Can you tell us that time period where you can
Yes,
make
the
changes?
Medicare annual enrollment period starts October the 15th and runs through December the 7th.
Okay, awesome. That's fantastic. There's so many. I had like at least 15 more questions, but we might have to bring you all back again. We'll just do another one focused on that. But look, that's fantastic information. We appreciate it. And now we'll give the last one to the good Senator John Horhn. Please tell us. Well, you're a household name here. We know who you are, but if you'd like to, please let maybe some that might not know, let them know who you are, how you'd
Yeah.
like to be if you contacted, and what you got going on.
Oh, yeah. I appreciate being able to come on Telehealth Tuesday to share a bit of information. Um, I know that this is a nonpartisan, non-political show,
Mhm.
but I will leave with this comment, and that is, make sure you educate yourself. We have a presidential election coming up soon on November 5th. Uh, I will just say that one candidate has a platform and a program where they want to cut out Social Security. They want to eliminate Medicaid. They want to eliminate Medicare and get rid of a lot of social services programs that the federal government offers. The other party has not come with that kind of platform. And so I would just suggest to your viewing audience that they educate themselves and find out which one of these folks is more focused on providing social services for the least of these in our country, and who is interested in attacking those programs. I won't say which party is doing what, but educate yourself about that. I'll also say that in a couple of days, we will be making an announcement here in the Jackson area concerning city leadership in Jackson, and we will be announcing our candidacy for a particular office that may be coming up this next spring of 2025. If you want to find out more, come to the Jackson Medical Mall at 12 o'clock on Thursday, and you'll find out.
Well done, Senator. I appreciate that, and we thank you all so much for being here. Thank you for watching Telehealth Tuesday. Next week, 7 p.m., we will have Dr. Kiera Emery who is a licensed pharmacist at PharmD. She owns her own company, CEO, founder and CEO of Emory Solutions. She's created several medications, very interesting, and I actually have them at my home. We've talked to her about possibly having them in our office. Fantastic young lady with an amazing story. She's also has served in the military. You don't want to miss this. We're going to talk we're going to talk drugs. We're going to talk costs. We're going to talk, anything related to that, and also what she can offer you to help with her natural products for hypertension, diabetes, and cholesterol. She has invented her own products. So you don't want to miss that next week. But again, thank you to Senator Horhn. Thank you to Angie Young. And upcoming, in terms of, I told you all last week, WAPT News, thank you. Shout out to them for featuring my wonderful patient who was a COVID survivor. They thought that she would have been left for dead. She was on a ventilator, which is a life support machine. We gave her convalescent plasma. We were the first physician at the particular hospital to give that. She is healthy. She is now married. Her daughter's doing well. And she was in my office, and we did a 2-minute special. And you can, if you Google my name, and it'll come up on WAPT on the app, and you can watch that. So God willing, we will see you next week, always on a Tuesday. And here, this is the place where we treat and discuss mind, body, and soul. And remember, true wealth begins with good health. Bye for now. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family. From virtual visits to office appointments, we're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth. Schedule your appointment today, and remember, true wealth begins with good health.